Hi, hello everyone. I'm myself Dr. Marathi. I'm going to discuss about probiotics, prebiotics, and symbiotics for preterm neonates. In this topic, I'm mainly discussing about the probiotics, like what are these probiotics, how they will benefit in preterm babies, and what is the dose, what is the time of initiation of the probiotics, and how much duration we have to give for babies, and what are its benefits, and what are the adverse effects of the probiotics, and lastly, and briefly about the prebiotics and symbiotics. Coming to the introduction, what are these probiotics? These probiotics are microorganism cultures that are administered to the babies to get the health benefits. In 1908, L. A. Metchnikoff was the first to describe the probiotics, and in 1952, lactobacillus was first administered to the neonate to examine its effect on the weight gain. And the first RCT related to the probiotics was published in 1986, and similarly, first meta-analysis was published in 2007. Coming to the mechanism of protection, how probiotics will add to the benefits. It like there are multiple mechanisms, and one of the mechanism is it enhance the gut barrier function mainly by decrease the gut permeability to the pathogenic organisms. And in other hand, it will also produce the antibacterial products and antifungal products that will inhibit the bacterial growth like mucus, secretory immunoglobulin A, and other bioactive factors. And these probiotics also modify the host immune response, and they act like a toll-like receptors to modulate the production of cytokines, and they will also inhibit the apoptosis. It also helps in maturation of the enteric nervous system in the preterm babies, so that will in turn improve the gut motility. And probiotics also decrease the colonization of the pathogenic microorganisms by competing for the space, binding sites, and nutrients, and also produce the antibacterial substances. And the first question is which babies, like who should receive the probiotics? Our always controversies between like BLBW versus ELBW. We all know the most common and the most important indication of probiotics is to prevent the necrotizing enterocolitis and feed intolerance. But both BLBW and ELBW infants are at highest risk of developing necrotizing enterocolitis. But in many RCTs and many studies, there is no statistically significant reduction in the NEC in ELBW babies. So at this point, the literature only supports the probiotic use in high-risk infants, that is babies with more than 1000 gram, but not in the ELBW babies. And regarding in this topic, there are many studies are still needed. And which probiotic formulations to use? Like we have to use single organism or mixture of the organisms, or which organisms we have to use. All this we will discuss. And there are multi-species probiotic supplementation is better in reduction of the NEC and mortality as compared to the single probiotic agent. And the studies showing there is almost reduction like they compared these two combination, and the relative risk of reduction of NEC is 0.39 in probiotic mixture as compared to the single organism. And which species? Like many studies, like all many studies that are published, they have species like they included species like Lactobacillus, Saccharomyces, Bifidobacterium, Enterococcus, and Streptococcus. But one published meta-analysis by Shaw et al. Shows that only minority of the probiotic strains had significantly statistically reduction in the NEC and mortality. So, at currently, lactobacillus and bifidobacterial species are found to be better beneficial. However, none of these organisms are uh, approved by any FDA. And regarding timing of initiation, duration, and the dose, there is significant heterogeneity in the probiotic studies regarding these initiation of timing and the duration and the dose and all. So there are many studies they use the various criteria to start the probiotics. For example, some studies they started within 48 hours, irrespective of the feeding status. Some studies they started after 48 hours, and some studies with first feed. So while understanding these timing of initiation, there are two important things we have to consider. Is like intestinal absorption may be altered in patients not receiving feed. So, while giving with feed, the absorption of the probiotics is better as compared to not giving with feed. And also, the immature, premature baby, the immature intestine may be unable to fully absorb before 48 hours of age. So, it is always reasonable to start at least 48 hours or with the initiation of feedings. Regarding duration of therapy, as I already told, the most important indication of giving probiotics is to prevent NAC. So, probiotics should be considered and continued till the risk for NAC is present. So, it may be till the discharge from the hospital, or it may be from 28 days after birth, or it may be till term gestational age. So, in general, it is 4 to 6 weeks or till discharge you can give. And regarding doses, the various meta-analysis and randomized control studies, they use various species with various doses and various frequency, and the doses ranging from 10 to the power of 6 colony forming units to 10 to the power of 9 colony forming units. And the frequency also varies, like twice daily, and other things. So, as of the preterm babies with very preterm gestational age and weight less than weight like uh, like very low birth weight, so better to start with OD doses like single doses per day, and later you can shift to the twice daily doses. And the most important thing is what are the benefits of starting probiotics in preterm babies? There are many beneficials, and the most important benefit is the prevention of the necrotizing enterocolitis. And little bit about the necrotizing enterocolitis. It affects almost 7% of the VLBW infants, and it's the most common major cause of mortality and morbidity in VLBW babies, and it can cause 20 to 30% of the mortality in VLBW babies, and other morbidities like bowel resection that can lead to short bowel syndrome, TPN related liver diseases, sepsis, adverse neuro outcome, and financial burden. So preterm babies they have less intestinal flora as compared to the term infants. So they need probiotic supplementation. So any alteration in the intestinal flora that can is a risk factor for development of the necrotic enterocolitis. So there are various studies that have studied the probiotics as a mean to prevent the necrotizing enterocolitis, and the various meta-analysis found statistically significant reduction of the severe NAC and all cause of mortality in preterm and VLBW babies. These are the various published meta-analysis as compared in this table, and they're showing the endpoints like stage 2 or stage 2 or more stage of NEC and all cause mortalities and sepsis. And all these meta-analysis, they given the number of studies and number of patients that are included and the study durations also, and various criteria like what babies should be included in the studies and other they are given. And while analyzing these all meta-analysis, the relative risk of developing uh, stage 2 or more NEC is like almost it is 0.35 to 0.43. So it means that there is 60% reduction of the severe necrotizing enterocolitis after supplementing with probiotics. Similarly, the mortality relative risk for mortality also decreases, like it is from 0.4 to 0.65. That means it is almost 40 to 60% reduction in the all-cause mortality. However, in sepsis as an endpoint, there is nothing like not significant reduction in the sepsis while supplementing the probiotics. However, like in individual randomized control studies, they have shown significant results. However, in all this meta-analysis, there is no significant reduction in the sepsis. And other benefits of probiotics, like it will decrease the time to full enteral feeds, and in like it will reduce the late onset sepsis in LBW babies but not in ELBW infants, and it has no effect on the risk of invasive fungal left sepsis, even though it will decrease the fungal colonization, and it will improve the neurodevelopmental outcome by anti-inflammatory effect and also decrease in the morbidities. And safety of probiotics, there are like very minimal side effects of probiotics, and one is the risk of sepsis secondary to the probiotic strain. Premature babies, like because of their immature immune system and the immature gut mucosal barrier function, they are at risk of developing sepsis secondary to probiotic strain. But at very only some case reports are there to support this risk of sepsis secondary to probiotic strains, but there are no RCTs and no meta-analysis. This lack of data or lack of this support for risk of sepsis secondary to probiotic strain may be due to these strains are not grow in the aerobic cultures, so they may be missed in the culture, and there is no systemic reporting system for adverse events. So because of this, there may be lack of data regarding this. However, probiotic organisms are weakly virulent and antibiotic sensitive. So infection due to probiotic strains is not only rare but also easily treatable. And other concern about safety of probiotics is contamination of the pathogenic organisms with the uh, probiotic cultures, like for example Rhizopus oryza, and also there is a theoretical risk of development and transfer of antimicrobial resistance. And this is a chart table that is showing individual case reports that are causing infectious complications of probiotics in neonatal patients. And among all these case reports, one baby had required colostomy, and two babies required bowel resections, and one baby had delayed enteral feedings, and most of these babies had developed NEC. However, there is in most of the babies there is no long-term complications. And the last thing is about little bit about prebiotics and symbiotics. And what is prebiotics? Prebiotics are exogenous products that will increase the probiotic growth by providing nutrients. For example, human milk oligosaccharides, fructo oligosaccharides, and there is no proven benefit in decreasing the incidence of NEC and mortality. Like in prebiotics, if you alone, they have no benefit. And similarly, symbiotics is a mixture of both the probiotic and prebiotic, and it has no additional benefit as compared to probiotics alone. Thank you so much.